I'm Dr. Joseph Raphael. I've been involved with TA Sciences and their product TA65 since about 2007, when Noel Patton, the founder of the company, came to my office and asked me what it would take for me to use this new sort of revolutionary product in my office. And I do a lot of biomarkers of aging testing. So I said to him, I want objective evidence that this works to reverse the aging process, or at least to slow it down in patients. So he agreed that we would run 100 patients through my practice, do biomarkers of aging on them, measure telomere length, immune system function, and that was the beginning of the first peer-reviewed paper that was published on the effects of TA65 on the aging process. We found that senescent T cells were reduced in the first paper. In the second paper that I was an author on, we found that the cardiovascular system markers were improved. There was some improvement in osteoporosis. So we saw changes in biomarkers of many different organ systems, which we would expect when a molecule can slow down the loss of telomere length, or in some cases actually lengthen telomeres. When I first introduced the concept of starting TA65, I usually do that after measuring a patient's telomere length. But even before that, the patients want to know, what could I expect to feel or see happen from taking TA65? And we've gotten a lot of anecdotal reports about improvements in vision. People that used to wear reading glasses sometimes are not wearing them anymore. And we actually have some studies where they've seen their optometrist or ophthalmologist beforehand, and there's a documented improvement in their farsighted vision. We've also seen some improvement in nearsighted vision. Patients very routinely say they have some increase in energy, increase sometimes in sex drive, and just generally some of our more elite athletes find that their recovery from workouts can be better at times. So those are some of the sort of things that we look at besides the subjective markers to sort of tell patients what effect it's going to have on them. When I first introduced the concept of taking a telomerase activator like TA65 to a patient, I tell them about the whole aging process and how shortening of telomeres is really one of the major linchpins of the aging process. So we often have a telomere length, if it's a little bit shorter than average for their age, which is, we sort of give them what we call a telomere age, which is if your telomeres are a certain length, they're that length for a 50-year-old, maybe you're 60 years old, so you're doing a little bit better, or maybe you're 70 and you've got telomere length of a 60-year-old, you're doing a lot better. So I'll introduce that concept to them, and everybody wants to sort of turn the clock back a little bit, but having that marker to say, I am a little bit short on telomeres is really a behavior motivator. The other thing that we talk about are the subjective changes that can take place in patients, and they want to see things like potentially improvement in graying of hair, improvement of hair growth. Some of my patients have seen some gray come out of their beards. So things like that motivate patients to get started on it. But I think the real thing is to sort of give them an overall picture of where they are in the aging process. And since telomeres are so important in that process, when they know where they are, that patients are like, okay, I've got to get started on this because it's going to be important for me. The other thing I tell patients about TA65 is not your average supplement. It actually started in clinical trials at a biopharmaceutical company called Geron back in the 90s, and they did much more safety testing in animals so that they could do a new drug application to the FDA. So this is a much more well-vetted supplement than your average supplement, so they're convinced about the safety from that respect, and they find that comforting in getting started on the somewhat cutting-edge therapy. I tell them about the myriad studies that have been done on the relationship between telomere shortening and all the chronic diseases of aging. There's very good correlations between cardiovascular disease. Short telomeres are associated with increased risk of cancer, osteoporosis, dementia, all the things that my patients themselves may be experiencing or they've seen in their parents. They want to try to prevent that. They want to live as healthy and happy lives as they can, so they want to hear about the literature, the vast literature that's out there about the relationship between telomeres and chronic diseases of aging. And then we have the studies that I've been participated in as one of the principal authors on whether TA65 actually works in humans. There are other products out there that might say that they're telomerase activators, but none of them have the scientific data to back them. Some of them may turn on telomerase, but it hasn't been shown to be absorbed in a human. So in these studies that I've participated in, the molecule is absorbed, it turns on telomerase, and it lengthens telomeres, as well as has other effects on other organ systems that we've talked about, like improving immune system health. That kind of information you don't typically get with your average supplement. So once they hear all that, they're ready to go. In addition to the randomized controlled trial where we showed a lengthening of telomeres in Spain, we have the trial results coming out showing the effect of TA65 on senescent T cells, or improvement in immune function. As we age, we start to accumulate old T cells that can't do their job anymore, but not only do they not do their job, they secrete a lot of inflammatory molecules that contribute to many of the diseases of aging. And we showed in this trial a large randomized controlled trial of 500 patients that TA65 reduced the number of senescent T cells by up to 20%, and looking forward to publishing that result. Educating patients about the role of telomeres in health and disease is one of the things that I do when I have a new patient come into my practice and want to talk to them about taking TA65, but there's a lot of information out there and really a little bit more limited time in the office. So I can point them to telomerescience.com, which is a library that has lots of articles to be read about the role of telomeres in health and disease. Many of them are somewhat accessible. There's some videos on there as well to help patients understand and to help doctors help their patients understand why telomeres are so important in the aging process and why they might want to consider taking a molecule like TA65.
I'm Dr. Joe Cleaver. I have a practice in California and Dallas, Texas, and my area of expertise is regenerative medicine and regenerative aesthetics. And I've been using TA65 in my practice for about the last 8 years. I started out using the capsules in the regenerative medicine side for anti-aging, and noticed that we saw a significant improvement in skin tone and a loss of wrinkles or wrinkle reduction in my patients. It's been shown to improve skin firmness by 90%, decrease wrinkles by 18%, redness by 10%, in addition, improve brown spots by 70%. I see that in my practice with my patients also. When we look at skin aging and we look at the products on the market, they're all targeting either building collagen or blocking the collagen from being broken down. There's no product that I'm aware of other than the TA65 that actually targets rejuvenating and turning back the clock in skin cells. So this makes it a unique product that I add into my other regimens, but it's also a great standalone product, especially when we add it to our telomerase activator capsules and treat the patient systemically. Just phenomenal outcomes. So when I see a patient for skin health and skin care and turning back the clock, my patients are often buying products off the shelf at drugstores and department stores that cost $300 a month. And when they see the results or lack of those results, and I introduce them to the TA65 cream, and I explain to them that the cost of it is going to be about the same or less, and when they see the results, after about 3 months, they're sold. They will continue the TA65 cream, and they're going to start throwing their other serums out. In my practice, I see an impressive improvement of skin tone and smoothing of that fine orange peeling. When they see the results at the end of those 90 days, they're sold on the product and they use it going forward.